Imagine walking into an emergency room. Right. Your lower abdomen is just an absolute agony because your bladder is like stretched completely beyond its normal physical limit.
Oh, that sounds like a total nightmare.
It really is. You are completely unable to pee and the pressure is just unbearable. But here is the truly terrifying part of this scenario. When the medical team rushes in to help you, they make this shocking discovery.
Yeah, and it's not what you'd expect, right? Not a kidney stone or anything.
Exactly. It isn't a kidney stone. It isn't like a bladder tumor. Your anatomy has literally sealed itself shut from the outside.
It's just wild to even think about that happening.
Right. So today we are taking you on a journey that completely shatters how we usually think about, the human body's boundaries. We have a highly specific and frankly mind-blowing mission for this deep dive.
We really do. We're going to answer a question that sounds almost impossible.
We are answering the question, can a skin condition actually cause you to be unable to pee?
And the short answer is yes. Yes, it can, but the biological mechanics behind how and why that happens are just absolutely incredible to unpack.
I mean, I was blown away when I read through the material.
Yeah, we are basically looking at a process where the body systematically overwrites its own architecture. It's fascinating.
To figure this out, we've pulled together a phenomenal stack of sources for you today. We're looking at the official guidelines from the British Association of Dermatologists, which are often referred to as the BAD guidelines, alongside the American Urological Association guidelines.
Two really heavy-hitting medical sources there.
For sure. And to really ground this in reality, we've got a fascinating clinical case report from the Journal of Case Reports and Images in Obstetrics and Gynecology.
Our core mission today really revolves around a condition called lichen sclerosus, or LS.
Lichen sclerosus. It sounds like something you'd find in the woods.
Right, like some rare botanical fungus growing on a damp log or something. But it's actually a relatively common chronic condition.
So we need to explore the severe ways that LS can progress from what initially just presents as severe itching, all the way to a total structural remodeling of the human anatomy, which ultimately leads to urinary dysfunction.
Exactly. The medical texts classify LS as an inflammatory dermatosis, and it primarily affects the anogenital region.
Okay, let's define that term first. When the sources say inflammatory dermatosis, they just mean like a skin disease characterized by intense chronic inflammation, correct?
It captures the absolute essence of it, yeah. It is basically a persistent state of high alert in the skin tissue.
And that chronic inflammation is exactly what drives the stakes of this deep dive.
Right. We're going to trace how a disease that operates solely on the surface layers of the skin can, over time, progressively alter deep structural plumbing.
Eventually stopping the flow of urine completely. Okay, let's unpack this. Before we can understand how a skin condition stops the flow of urine, we first have to understand what it does to the skin and tissue at, like, a cellular level.
Yeah, that's crucial context.
The sources indicate that the etiology, so the root cause of LS, isn't entirely nailed down by science yet, but the physical changes it causes are pretty unmistakable.
Oh, very unmistakable. The affected skin becomes incredibly fragile.
Right, it gets shiny, tight, and turns this very distinct, porcelain white color.
Yeah, dermatologists frequently describe it as taking on a wrinkled cellophane paper appearance.
Cellophane paper. Wow.
I know, right? The skin just loses all of its natural elasticity and structural integrity.
Just imagine skin that is supposed to be flexible and resilient, stretching with every movement, suddenly feeling like thin, crinkly plastic.
It sounds so uncomfortable. And, in women, the sources note it often forms a classic figure of 8 or like an hourglass shape, encompassing the vulva and the perianal area.
Right. What's fascinating here is the underlying biological mechanism driving that change. Because while we don't know the exact initial trigger, the evidence strongly points to an autoimmune origin.
Yeah, the sources note a highly specific detail about that. They found that 60 to 80% of women with vulval LS have autoantibodies to something called extracellular matrix protein 1.
Or ECM1, right?
Exactly, ECM1.
Extracellular matrix protein 1. That sounds like the structural scaffolding of the body.
That is a brilliant way to visualize it, honestly. The extracellular matrix is literally the biological mortar between the bricks of your cells.
Oh, I like that. The mortar between the bricks.
Yeah. It is a complex network of proteins that gives tissue its physical structure, its hydration, and, like we mentioned, its elasticity. And ECM1 is the key player in that mortar.
But wait, why would the body suddenly attack its own mortar?
Well, in autoimmune conditions, the immune system's sentinels, the antibodies, essentially experience a case of mistaken identity.
So they get confused.
Right. They're supposed to seek out and destroy foreign invaders, like viruses. But a glitch causes them to misread ECM1 as an enemy.
Oh, wow.
So your immune system launches a localized war against the scaffolding of your own skin. And as that structural integrity breaks down, the body desperately tries to heal the damage.
But it doesn't heal correctly.
Exactly. Because the environment is so intensely inflamed, it heals with dense, rigid white scar tissue instead of normal, healthy, flexible skin.
Which brings us to a really crucial concept in this disease, the Koebner response, or Koebnerization.
Oh yeah, this is a massive factor.
This seems to be the main accelerator of the disease. The sources explain that friction, damage, or irritation to the skin actually triggers or worsens the LS.
Right, so in a healthy immune system, if you rub or scratch your skin, it gets a little red, the blood flow increases to repair any micro tears, and then goes back to normal.
Just standard healing.
Yeah. But in a patient with LS, that physical trauma acts as a blaring siren, calling
Okay.
massive amounts of those confused immune cells straight to the area.
So they rush in and launch another attack.
Yep, creating even more of that cellophane-like scar tissue.
So the Koebner response is kind of like a pothole in a road. The more cars drive over it and irritate it, the wider and deeper the damage gets.
Instead of the body just, sending a crew to pave it over and
Yeah.
fix it.
Yeah, exactly. So the continuous traffic over that pothole is a perfect analogy for everyday life.
It really is. That friction can be the seam of tight underwear, the constant pressure from a bicycle saddle, or, crucially for our topic today, exposure to urine.
Urine acts as friction?
Well, chemical friction, yeah.
Like-
Even minor, microscopic urine leakage acts as a continuous chemical and physical irritant, keeping that siren blaring and just worsening the disease.
Okay, so if the mechanism relies heavily on this continuous irritation from urine, how does this actually manifest in male anatomy?
That's a great question.
Because it seems like the anatomy itself would dictate how the disease progresses, right?
It absolutely dictates the progression. In men, genital LS was historically called balanitis serotica obliterans.
That seems extremely intimidating.
It does. But it is the exact same underlying disease process we just described. And what the sources highlight is that in the absence of other specific traumas, this condition almost exclusively affects uncircumcised men.
Wait, if it almost exclusively affects uncircumcised men, is this just like a hygiene issue?
A lot of people think that, actually.
Like, is the immune system just reacting to bacteria that hasn't been washed away?
No, it is a common misconception, but it has absolutely nothing to do with hygiene.
Okay, good to clarify.
The mechanism is entirely structural. It's based on the physical microenvironment created by the foreskin.
Okay, take us through the mechanics of that environment. How does the urine get involved?
Sure. After a man urinates, a tiny, sometimes completely microscopic drop of urine can remain trapped or occluded under the foreskin.
Right.
In a circumcised male, that post-void drop simply gets absorbed by closing or just evaporates. But in an uncircumcised male who has the genetic predisposition for LS,
That trapped urine sits directly against the fragile mucosal tissue. And there is our continuous traffic hitting the pothole.
you nailed it. That chronic, intermittent exposure to trapped urine causes microscopic chemical damage to the skin.
Which triggers the Koebner response we talked about.
Right. The immune system overreacts to the urine exposure, massive inflammation sets in, and that rigid white scar tissue begins to form on the foreskin and the head of the penis.
Let me make sure I'm following this brutal chain of events.
Go for it.
The trapped urine triggers the inflammatory disease, and the disease creates rigid scarring that narrows the opening of the foreskin, which would then trap even more urine.
It is a totally vicious, self-perpetuating cycle.
That is awful.
It really is. As the scarring progresses, the skin loses its ability to stretch. This leads to a structural condition called phimosis, where the foreskin becomes so tight and thickened with scar tissue that it can no longer be retracted.
It essentially fuses into a rigid bottleneck.
Exactly. But the sources say it doesn't stop at the foreskin. The scarring actually attacks the opening of the urethra itself, causing something called meatal stenosis.
Wait, the exit hole literally shrinks.
Yes, this is exactly how a surface skin disease causes profound urinary retention from the inside out. The disease doesn't remain isolated on the surface.
It spreads.
Yeah, the inflammation can spread proximally.
Proximally meaning it travels deeper into the body toward the center.
Correct. It creeps backward, up into the penile and bulbar urethra.
The bulbar urethra being the deeper section of the tube that passes through the bulb of the penis closer to the pelvic floor.
Exactly. And the LS literally replaces the soft, flexible mucosal lining of the entire urinary tract with rigid, unforgiving scar tissue.
Wow.
In urology, this internal narrowing is called a urethral stricture.
And the BAD guidelines report a staggering statistic here. They say urethral involvement occurs in 20% of men with LS.
It's huge.
1 in 5 men with this skin condition end up with internal scarring in their plumbing.
And that internal stricture acts as a physical choke point. As the tube continually narrows, the patient begins to notice a weakened urinary stream.
They might experience spraying, dribbling, or like a constant nagging feeling like they can't completely empty their bladder, right?
Right. And eventually, if that stricture closes up entirely, they experience sudden, acute urinary retention.
Where the bladder is completely full and trying to squeeze the urine out, but the pipe is cemented shut by scar tissue.
It's terrifying because it happens so insidiously.
Wow.
The skin essentially suffocates the plumbing over years.
Okay, so in men, the scarring creeps directly inside the pipe. But what happens in female anatomy?
It's a very different process.
Because the urethra isn't wrapped in that same sort of mucosal envelope, does the disease just stop at the surface?
It does not stop, no. But the mechanism of obstruction is entirely different. In females, LS rarely attacks the interior of the urethra itself.
Okay.
You don't typically see those internal strictures creeping up the pipe. Instead, the chronic inflammation causes profound, irreversible architectural changes to the exterior of the vulva.
The disease essentially remodels the entire local landscape.
Remodels the landscape is a really vivid way to put it, though it's a deeply destructive remodel.
Yeah, the sources detail how the labia minora, the inner lips, can shrink, flatten, and eventually be completely resorbed into the surrounding tissue.
They simply disappear.
And the clitoral hood can fuse shut, burying the clitoris beneath a thick layer of scar tissue.
We are seeing the exact same scarring process, the destruction of the ECM1 protein and the creation of rigid cellophane-like tissue, but it is playing out on entirely different anatomical structures.
The skin thickens, loses all elasticity, and begins to fuse together.
Right. And this brings us directly to that incredible clinical case report from the Journal of Case Reports and Images in Obstetrics and Gynecology.
Oh, man. This case report is what truly blew my mind during the research for this deep dive.
It's intense.
It centers on an 82-year-old woman who arrived at the emergency room. Let's set the scene for you listening. She presents with severe lower abdominal pain and what the medical charts call dysuria.
Dysuria simply translates to pain or extreme discomfort when attempting to urinate.
Right, so she is in absolute agony, trying to pee but completely unable to.
And the ER doctors do a point-of-care bladder ultrasound, right?
Yes, and they discover she is in acute urinary retention. The scan showed she was holding 400 milliliters of urine in her bladder.
Wow. To put 400 milliliters in perspective, that is roughly the size of a large mug of coffee.
That's a lot of liquid to have trapped inside you.
Having that trapped in a distended bladder is a massive medical emergency. It requires immediate intervention.
Right, because her bladder could rupture.
Exactly. The standard protocol there is to insert an indwelling catheter, which is a flexible tube, passed up the urethra into the bladder to drain the fluid instantly.
But when the medical team went to place the catheter, they encountered a physical impossibility.
They literally couldn't find her urethra.
Because the lichen sclerosus had completely overwritten her anatomy. The doctors found a smooth, fused wall of tissue where the normal anatomical landmarks should have been.
It's just wild.
To understand the mechanics of what happened to this woman, let's contrast it with the male experience we just talked about. In men, the pipe itself gets clogged from the inside by scar tissue.
Right, the stricture.
But in this 82-year-old woman's case, it was like a massive boulder sitting on top of a garden hose, just crushing it flat from the outside.
The physics of that analogy are totally spot on. Upon closer examination, the doctors found that her labia majora, the outer lips, had completely fused together in the midline due to years of severe, untreated LS scarring.
They had effectively glued themselves shut.
Leaving only a microscopic, pinhole-sized vaginal opening.
So this massive fusion creates a physical barrier. It essentially builds a dam.
A literal watertight dam. Because that remaining opening was so microscopic, Normal daily vaginal secretions couldn't escape.
Oh, wow.
Furthermore, every time she attempted to urinate, a small amount of that urine would flow backward, splashing behind the fused labia.
Oh, so it gets trapped.
Yes, this is called retrograde urine flow. Neither the secretions nor the trapped urine could bypass the dam.
And over time, I mean, presumably months or even years, that trapped fluid just built up, creating immense pressure inside the vaginal canal.
Yeah, it accumulated into a massive, fluid-filled pocket, medically termed a colpos.
Okay, let's break that down.
Sure. PO refers to fluid or pus,
Hmm,
and colpos refers to the vagina.
got it.
This PO colpos grew so large, heavy, and pressurized that it became the boulder in urinology.
It physically ballooned outward.
Right. Pushing relentlessly against the anterior wall, the front wall of the vagina. And because the urethra sits directly in front of the vaginal wall, this massive fluid pocket compressed her urethra flat from the outside.
That is an unbelievable chain of events. The skin disease fused the exit, the fusion trapped the body's own fluids to form a mass, and the mass crushed the urinary pipe shut.
Exactly.
If you're listening to this and thinking, how could someone not notice their anatomy changing so drastically? You have to remember this happens on a microscopic scale.
Yeah, cell by cell, over decades. It's so often dismissed as just normal aging or simple irritation.
It perfectly illustrates the danger of leaving chronic inflammation unchecked.
Absolutely. The medical team eventually had to perform a surgical drainage for her.
So they relieved the pressure.
Yeah. Once they drained the trapped fluid, the boulder was lifted, the pressure on the urethra was relieved, and her bladder could finally empty.
But the architectural destruction to her vulva was permanent.
Sadly, yes.
Which logically brings us to the critical question of intervention. We now understand the two distinct biological pathways LS uses to physically block the flow of urine,
Internal strictures clogging the pipe in men.
and external anatomical fusion causing compression in women. So how does medical science attempt to halt this process or repair the plumbing?
The absolute most effective defense is early, aggressive intervention.
Catching it before the damage is done.
Exactly. The gold standard, first-line treatment across all urological and dermatological guidelines is the application of ultrapotent topical corticosteroids, most commonly an ointment called clobetasol.
Wait, let me stop you there. If this disease is capable of fusing anatomy together and causing urinary retention, how does rubbing a steroid cream on the surface actually fix anything?
I know, it sounds too simple.
Mm.
But it works by directly shutting down the localized immune response we talked about earlier.
The confused immune cells.
Right. Think of the corticosteroid as an emergency stop button on an out-of-control assembly line.
Okay, I can picture that.
When you apply the ointment, it penetrates the skin and forces those confused immune cells to stand down.
Oh, so if you freeze the immune system's attack early enough, the assembly line never gets a chance to produce that rigid scar tissue.
Exactly. You halt the disease before the architecture is destroyed.
But what if the patient doesn't get diagnosed in time? What if the assembly line has already been running for a decade, and the patient presents with a severe stricture or retention?
In that case, the AUA guidelines are very clear. Once thick scar tissue has formed and narrowed the urethra, ointments are not going to reverse it.
So you need surgery.
Surgical intervention is completely required. For men suffering from a urethral stricture, the procedure is called a urethroplasty.
So the surgeon has to physically cut out the scarred, narrowed section of the internal pipe and reconstruct a new, wider tube so urine can flow freely.
Yes, but here's where it gets really interesting. When a urologist goes in to rebuild that internal pipe, the guidelines issue a very strict, specific warning.
Oh.
Surgeons must absolutely not use local genital skin to patch or reconstruct the urethra in a patient with LS.
Now, that is fascinating. If we connect that warning back to the bigger picture, the fundamental biological nature of LS, the rule makes perfect logical sense.
Right, because remember, lichen sclerosus is fundamentally a localized autoimmune disease targeting the specific cellular environment of the anogenital region.
So if a well-meaning surgeon cuts a flab of skin from the penis or the remaining foreskin to widen the urethra, the immune system is just going to look at that new patch, recognize the ECM1 protein structure, and launch a brand new attack.
It is a guaranteed relapse. The transplanted tissue contains the exact same genetic and structural markers that the immune system is already primed to destroy.
Wow.
So the new patch will inevitably develop LS. It will scar over into rigid cellophane again, and the newly rebuilt urethra will choke shut. The surgery fails.
If they can't use the skin that is already right there in the surgical field, where do they source the spare parts to rebuild the urinary tract?
This is where surgical ingenuity is just truly remarkable.
Okay.
Instead of using genital skin flaps, urologic surgeons utilize oral mucosa.
Wait, from the mouth?
Yes. They harvest a tissue graft from the inside of the patient's own mouth, specifically a buccal graft taken from the inner cheek, or occasionally from under the tongue.
It is absolutely wild to me that tissue from the inside of your mouth is being harvested to rebuild a failing urinary tract.
It sounds like science fiction, but it's true.
But biologically, why does the cheek tissue work when the local skin fails?
It succeeds for a few highly specific biological reasons. First, from a purely physical standpoint, the mucosal tissue inside your mouth is constantly bathed in saliva,
Right.
so it's evolved to thrive in a constantly wet environment, making it a perfect biological match for the inside of a urethra that is constantly exposed to urine.
That makes a lot of sense.
Second, oral mucosa is incredibly robust and heals rapidly.
But what stops the immune system from just attacking the cheek tissue once it's transplanted down there?
And that is the most crucial part. The tissue from the mouth has a completely different structural code than the genital skin.
Oh.
It doesn't have the same local immune receptors or the exact same ECM1 profile that triggers the disease. By bringing in tissue from a completely different zip code in the body, you bypass the localized autoimmune response.
So it's like bringing in a specialist contractor from another country who doesn't speak the language of the angry local protesters.
Oh, that is a phenomenal way to picture it.
The immune system simply doesn't recognize the cheek tissue as the enemy it's looking for, so it leaves the graft alone and the newly built pipe stays open.
Exactly. The graft is biologically invisible to the specific autoantibodies driving the LS.
That is incredible.
Because of this, the long-term success rates for buccal mucosa grafts in these complex LS stricture cases are remarkably high. It completely changed the landscape of treatment for men suffering from these severe blockages.
So what does this all mean for you listening right now? We've gone deep into the microscopic destruction of structural proteins, fluid dynamics, and oral mucosa grafts.
A lot of heavy science today.
But the practical takeaway here is surprisingly simple. Chronic urinary symptoms, whether it's noticing your stream is getting weaker over the years, needing to bear down and push to pee, experiencing a strange spraying effect, or just that nagging, persistent feeling like your bladder isn't actually empty when you leave the bathroom.
Yeah, those symptoms should never be ignored or dismissed as just getting older.
It raises a vital question for anyone experiencing those subtle shifts in their daily routine. Are you automatically assuming it's a bladder issue or a prostate issue just because that is what society tells us to look for?
Exactly. Because as we've dissected today, the problem might not originate in the plumbing at all.
It could be the result of a completely undiagnosed autoimmune skin condition silently and systematically altering your surrounding anatomy.
It's not always the pipes failing. Sometimes it's the drywall collapsing and crushing the pipes.
Great point. If you have any of these slow-moving urinary symptoms, especially if you also notice unexplained itching, soreness, or distinct white cellophane-like patches in the genital area, you need to bring it up with a doctor.
Do not be embarrassed.
Catching this at the pothole stage, where a simple steroid ointment can act as the emergency stop button, can save you from a massive, complex reconstructive surgery down the line.
And as we wrap up this deep dive, I'd like to leave you with one final thought to mull over.
Go for it.
Today we examine how a microscopic drop of trapped urine, or the everyday friction from a bicycle seat or tight clothing, can trigger a localized autoimmune response so severe that the body literally overwrites its own foundational architecture with rigid scar tissue.
It takes a seemingly harmless variable and uses it to completely reshape the human body.
It truly highlights the profound, unseen interconnectedness of our internal systems and just how fragile our biological equilibrium really is.
Yeah.
If a single drop of trapped fluid can cause a surface skin condition to systematically shut down the bladder, what other everyday environmental exposures, microscopic frictions, or seemingly harmless daily habits are slowly rewriting our biology right now, entirely without us noticing?
That is a thought that will definitely stick with you the next time you get dressed in the morning. Just because the categories of the human body look neat and separate on the outside, it doesn't mean the wires aren't profoundly intertwined on the inside.
Very true.
Keep questioning those neat little boxes.